Dr. Lawrence Eichenfield, and before we go into a discussion on new articles about atopic dermatitis, I thought just we should discuss a little bit about an overview of the pathogenesis of atopic dermatitis. We should remember the clinical manifestations of eczema are really mediated through a mixture of genetic, immunologic, and environmental factors. Been a lot of research on barrier dysfunction. We know subsets of individuals have deficiency in filaggrin with these mutations in the skin, which give a higher rate of the development of atopic dermatitis, also responsible for the xerosis dry skin of atopic dermatitis. There's also an association with decreased ceramides, overactive epidermal proteases. And this setup of the skin probably creates a scenario where the skin is more easily penetrated by antigens, which can set up some of the inflammatory responses in atopic dermatitis. Much research on the immunology of atopic dermatitis. We know it's a Th2 predominant disease, so T helper cells and T regulatory cells are important in the inflammation of atopic dermatitis. Also, antigen-presenting dendritic cells, innate lymphoid cells, mast cells, and eosinophils all contribute to the inflammation of atopic dermatitis. And of course, we know a variety of environmental factors can influence atopic dermatitis, both microbes on the skin. There's higher Staph aureus colonization. There are environmental and climatic factors that can influence flares of the disease. Skin pH also regulates epidermal function, and there is a loss of some of the acidic pH in atopic dermatitis skin. So a variety of factors that mediate the clinical aspects of atopic dermatitis, but also reflect the underlying pathogenesis, which is a mixture of barrier dysfunction and inflammation.